Hi, Umer. How are you today? Can you hear me? Wait. I cannot hear you for some reason.
Okay, can you hear me now?
Yep, I can hear you now. Hello. Hi, Umer. Hi, everybody
Hi.
who decided to join us today for a live event. And of course, all this is going to be recorded. And welcome to anybody who's watching this as a recorded version, basically. And yeah, just a quick reminder: it's on every single platform. So if you don't like, I don't know, something about any of the platforms, you can go and switch to a different one. It's going to be on YouTube, LinkedIn, Instagram, and Facebook. So, Omar, I'm gonna give around like 1-2 minutes because I saw some people signed up for the
Hmm.
event on LinkedIn. I saw some attendees there, so I'm just gonna give like a little time for them to come before we actually
Okay.
dive in and start talking about the topic of the main topic of the discussion today.
Yeah, sure.
Yep. And also, as a quick reminder, today we're going to be talking about Agentic AI. And yes, I have a lot of good questions that I prepared, and
Hmm.
we'll go from there. And I'll also introduce you, Umer, so don't worry about that. You will
Oh,
be properly
I'll appreciate that.
yeah, you'll be properly introduced. No problems about that. And I'll be also uh, I'm going to be moderating a little bit, looking at the questions. Maybe if there's something comes in, I'll make sure to ask you. And if any questions comes in after the event, you can post the questions, post comments, and then we'll make sure either me or Omer will answer all the questions you might have. I guess that's pretty much it. Let me
Mhm.
just make sure that I see you everywhere and everything works fine. Yep. Let me just make sure. Quick thing. Okay. So, everybody, welcome to our conversation today. I brought Omar back again
Mhm.
for our chat. Today, we're going to be talking about the topic is maximizing ROI with agentic AI in healthcare. First, let me introduce Umar. He's basically in-house. We call him in-house AI expert. He knows much more than any of us combined about AI, and AI being on like topic of every single discussion nowadays. It seems like it in any single part of the world and any single industry. So he's our expert on AI, and that's why we bring him to basically explain to our viewers, our subscribers, even us, what AI is and what's going to be in the future. So, Omar, you want to say a few words about yourself so people remember who you are?
Sure, sure. Why not? Yeah. So my core expertise are in basically I'm a tech guy. So artificial intelligence, data science, and machine learning. And I have been working. I'm not a researcher, but I have been working on delivering large scale projects to large enterprises, specifically in the domain of data science and AI. And recently, I'm working on a couple of agentic AI projects. So yeah, healthcare is one of my favorite areas. Other than this, I also specialize in ed tech as well. So yeah, would love to answer the questions that come forward from your side and the audience.
Yep. So, without further ado, let's dive in and start with today's discussion. And again, for viewers, we're not gonna keep it too long, so no worries about that. We're not gonna like rumble and mumble for a long time. So, let's dive in. My biggest question is and we came up with the topic kind of together, and you gave it to me as an idea. I was like, okay, I don't know. Me personally, I don't really know a lot about agentic AI. I know about ROI, so in
Mhm.
the topic itself. So I know all the words except for agentic AI. And I think this is something that not a lot of people know yet. And I would want to start with this, like kind of basically give like an overview of what AI is.
Sure, sure. Why not? Why not? So I'm sure everyone knows about artificial intelligence. We know about generative AI. We know some of us might know about the large language models, which are pretty much in place, and the main thing behind the generative AI stuff. So, but what is agentic AI? To put this forward in simple words, it's basically a next generation form of artificial intelligence. It basically doesn't just analyze the data like AI does or follow the preset rules. It acts basically autonomously. So this is the major difference: making decisions and executing tasks without continuous human oversight. And unlike traditional AI, which is primarily reactive and totally depends on the predefined instructions. So agentic AI is proactive, adaptive, and capable of dynamically interacting with its environment. So let me give you an example. Um,
Yeah.
Traditional AI in healthcare might flag an anomaly in a patient's lab results, but again, it requires doctors to take action. It's fully dependent on it because it's built on the rule-based system at the end of the day. But agentic AI, on the other hand, basically can go a step further, which it does not only detect the anomaly but also recommends a treatment plan and can also initiate a prior authorization request maybe with insurance, and then also schedule appointments or any sort of alerts to the care team, so all in real time. So this shift is basically from task-based automation to intelligent autonomous agents means that healthcare operations can become more efficient, reducing the manual work and optimizing the workflows. So therefore, ultimately, at the end of the day, improving the patient outcomes.
And
So
then
yeah.
you're saying agentic AI is kind of like being kind of your agent, more learning with you and doing stuff that, as you said, let's use your example about prior authorizations. So
Mhm.
basically, me, let's say I'm a practice manager, do I initiate that request, or how's it, or this agentic AI realizes, oh, I have to do the prior authorizations for this client? How
Yeah.
does that?
So again, any artificial intelligence thing that you see is again trained on, on the preset data.
Yeah.
So once with your EHR, it's integrated with the payers, it's integrated. So it's definitely certain that you have lots of workflows data already there. So it automatically learns from there, and it knows what to do next based on the previous interactions, and based on the workflows that have been at the higher level designed in while building the agentic AI.
Okay. 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 But I want to circle back kind of to the main topic is the maximizing ROI, and
Hmm.
specifically dive into this with like you saying that with agentic AI we can maximize the ROI. So today is a little bit inefficient, basically from the topic itself. So
Hmm.
what would you say is in today healthcare world? What are some financial inefficiencies, and also like how can this agentic AI, as we're talking about it today, how can it help to improve and avoid those inefficiencies?
Yeah. If our listeners, anyone who's listening to us, is a financial is basically a healthcare practitioner, they would definitely know the major financial inefficiencies in healthcare. Like which are some of the inefficiencies which are deeply embedded in the legacy workflows. One of the biggest one is the administrative overhead. So, like hospitals and clinics spend billions annually on manual paperwork and billing and insurance related tasks. So the revenue leakage is another major issue caused by inaccurate coding, denied claims, the billing errors that slow down the reimbursements, and additionally, I would say the poor resource utilization, such as an inefficient or the operating room scheduling or maybe accessing staff costs, excessive the staffing cost, I would say, which leads to the wasted expense. And what agentic AI does, it significantly reduces its inefficiencies and automatically, it automates the routine, yet, complex processes. For example, it can autonomously handle prior authorizations, like I said, and ensure that the approvals are obtained faster with fewer denials. So yeah, this is basically the operational inefficiencies can definitely be brought down with this.
and and then you can use agentic AI is not kind of like, instead it's kind of an extension to the, so what I'm saying is an extension to the existing team, meaning that let's say I'm a practice manager and I see that my team is great, but they're like let's say 80% accurate or 90% accurate, and if I want them to be 100% accurate like everybody does, uh, this is where I implement this not instead of the current team which is in house, but like kind of adding it on as like as a helper to do all the kind of insurance stuff, prioritizations, referrals,
Yeah.
all eligibility checks, all that stuff.
Yeah. So it's
Okay.
not about, I would say it's not about accuracy. It's about, the process automation, I would say. The to and
Mm-hmm.
fro processes. Let's say the claims are getting denied, and then what to do. So lots of human being involved, the human resource involved, and some lots of human errors are also there. Like the coding errors. So these things, agentic AI definitely is excels than the traditional legacy AI.
Okay. 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 Good. Yeah. I'm just I'm the same as viewers and everybody who's watching right now. I'm learning as we go because this is all new to me. I'm trying to understand how we can implement it with us at MD Health Tech
Mhm.
and Tech Books. The main topic for me from this is to pick up is what we can do to make the life of practice managers and our clients and our customers easier and
Mhm.
better for them and more again, everybody wants to save the dollar, everybody wants to be more profitable than they are today, and so this is my thought of like being a good helper to the current clients that we have and maybe potential future clients that we're going to come on board. That's how we can make the lives better. Okay, so now let's say I'm a practice manager. I already decided I want to implement some of the things you're talking about,
Mhm.
and I would assume there's already something out there that we can use, like some platforms that are already using agentic AI. Is there any?
Mhm. Yeah, yeah, they are. They are. I mean, lots of innovations are going on, and lots of new stuff is coming in the healthcare domain. Yeah.
Yeah, is there okay? And then I know that Epic is developing their AI, like their AI platform. They're big into that. Uh, Maybe there's something else, but
Mhm.
again, this is the reason I'm asking. Like, and the other thing is that it evolves so fast
Mhm.
every day that we can't even try. Like, I will say something today, and then tomorrow there's going to be a brand new model, and
Mhm.
it's completely disruptive, and we didn't even think of. But
Mhm.
it's not about the names, it's about like the technology itself. So agentic
Yeah.
AI is a little bit different from the regular AI from what I'm understanding. It's a little bit like a
Yeah.
little bit different idea kind of, but like the names that comes with it, it's not the most important thing. Yes.
Yeah. So, Epic, like you said, Epic AI. Yeah. I mean, this platform focuses more on predictive analytics,
Uh-huh.
and identifying the high risk patients and preventing hospital readmissions, and ultimately reducing the unnecessary hospital cost, the healthcare costs. But there are some other tools like we have Innovator AI. It's this platform is more about using AI agents to streamline prior authorizations and also to automate the revenue cycle management and ultimately reducing the administrative delays and improving the claim success rates. And then there's another one which is called Olive AI,
Mm-hmm.
or how would you pronounce it? Olive AI, yeah.
Yeah.
That tool basically what it does is it it's known for automating the repetitive healthcare processes. So it uses like agentic AI to optimize the eligibility checks, uh, and then also automate the claims processing and then reduce the billing errors.
Okay.
So yeah, these are some of the tools. Yeah, I mean, which are pretty good, and I'm sure there are more to come in the coming years.
Yeah,
I
I
would say
mean
coming
for
up.
sure. Yeah, for sure. With how everything is evolving, how fast everything is going, and
Yeah.
yeah, it's brand new names coming in, brand new ideas coming in. But like the main thing is that automating and making. I'm gonna say from my experience, we have a lot of customers with us with MD Help Tech. I mean, obviously we communicate most of the times with practice managers, but there are like some people that run the front ends, like the receptions, or some people
Mhm.
that just run in-house. I don't know, prior authorizations, referrals, all that stuff. And practice managers, every single one that come to us, they say it's it's so hard on them, and then it's so hard, and it's constantly on the phone, constantly being running around trying to get to through the waiting line, through the insurance, trying to get to the right person, trying to basically like all the hard work, all the laborious, and it's not that rewarding, unfortunately. And that's kind of the biggest complaint that we hear. And having the AI helping people out, first of all, it's going to reduce burnout because you do
Yeah.
all the same thing every time, all day, every day. Like I have respect for people that do it, but
Mhm.
it's really laborious work, and unfortunately, a lot of people quit just because it's like the same mundane task every single day.
Mhm.
And insurance companies, unfortunately, are not making it easier
Mhm.
for doctors to get an approval, get a good prioritization, easy
Mhm.
prioritization, easy referral, easy eligibility check. None of that, unfortunately, nowadays happening. So yes, that's a big shift that I hope
Yeah.
I really want them to feel better and have a better lifestyle. And I think that for them
Yeah.
it's something that AI is going to replace them, because there's still a
Yeah.
lot of stuff that it's like face to face, more personal,
Mhm. Agree.
but it's going to make it so their life so much easier, in my opinion. And uh, going on and talking about a little bit from a practice manager perspective now. Let's
Mhm.
say I'm a practice manager, and I decided,
Mhm.
okay, today's the day. I'm gonna go. I'm gonna switch. I'm gonna help out my in-house staff team, and I'm gonna make their life easier. And I'm gonna
Mhm.
implement some AI. But
Mhm.
coming back to the topic of our discussion, I also want to maximize ROI. So I don't want to go out there spend so much money and then get so little return. So
Mhm.
what would you spend your money on first? What would you automate first? Yeah, what would you automate first? Let's start with that.
Yeah. So, well, I believe the best place to start is with administrative automation, because specifically the revenue cycle management and also the prior authorization stuff. So these areas are basically high cost and high volume, and making them ideal for AI driven efficiency improvements. So automating prior authorization with agentic AI can actually reduce approval times from days to minutes, literally minutes, and cutting down the delays that often result in patient classification and then revenue loss, the things which you were talking about. Uh, and then similarly, using AI for claims processing and denial management, this also ensures that reimbursements, they happen faster, and then definitely reducing revenue leakage. And interestingly, there's this study that shows that AI powered revenue cycle management can lower claim denials by up to 50%, and definitely leading to quicker cash flows at the end of the day. And
Hmm.
lastly, another quick win area is basically hospital scheduling, the optimization of hospital scheduling. Like AI agents can predict patient no shows, like optimize operating room schedules, and can also ensure staff resources are basically allocated efficiently, and therefore reducing the unnecessary costs. So yeah, and these kind of lastly, these kind of implications require minimal disruption, but deliver significant
Yep.
financial gains almost immediately.
Yep. And I also heard like with prioritizations, that's a great example, because I think in my experience, that's the most
Mhm.
time consuming task there is. And unfortunately, nowadays, insurance companies are not making it any easier. By what I mean is like whenever you call, back in the day, like a couple of years ago, you were able to, let's say, somebody has like a practice manager or like somebody who's doing prioritizations has to call, and he can go like through four different cases on one call.
Mhm.
Unfortunately, now you have to do only one case per call, and then
Mhm.
whenever you hang up, you get back in line where you started, and then get
Yeah.
back in line can be like after 3 hours, and that
Yeah.
is not exaggeration. People are waiting that long. So at least like in my what I'm thinking now is maybe automating
Mhm.
that instead of waiting for 3 hours, maybe making an AI make a phone call, and whenever somebody ready to talk to you, you switch, and maybe you're not waiting that 3 hours in line. Maybe something like this. I don't know. I'm throwing out ideas that come into my head.
Mhm.
Maybe somebody is going to go out there and implement that. Umar, I have a question for you that came from the chat.
Mhm.
And so the question is the following. So, how can AI driven chatbots and virtual assistants, so AI driven chatbots that we have on the website, for example, or virtual assistants, help chronic disease patients with self care and medication adherence?
Okay.
And
Yeah,
yeah.
that's an interesting use case of AI. I wouldn't say agentic AI, but yeah, agentic AI can further be used for any sort of actions, or let's say if there is like back-to-back processes involved like in a traditional workflow. But yeah, so chronic diseases patients, there are numerous apps which actually help them, assist in their day-to-day lifestyle. So for example, if we take an example of a diabetic patient, so if there
Hmm.
is an app that is basically trained for that is basically programmed or trained for assisting the basically the chronic the diabetic patients. So that is definitely going to help them improve their lifestyle, and it can capture the data from different sources on their mobile phone, maybe the smartwatch device, or maybe the glucometer which they are wearing, and then it can basically propose based on the past data again. uh, it can propose uh, how you have to function and what kind of lifestyle changes you need to have, when you have to wake up, what you need to eat, and these kind of things can definitely be like an assistant play a very good role on day-to-day basis. So personal assistant or chatbot, they both do the same things. If it is a personal assistant.
I think we lost Umar for a second here. Once he comes back, he can keep going with his answer. I'll I will dive in and I'll give my answer to that question. Is and again, this is my just personal experience. I'm not a licensed professional or anything. I'm just having a lot of experience talking to the talking to the clinics and having them as our clients, as our customers. So what I would say is that a lot of development happening in an AI world and chatbots as being like a helper. And I don't personally use it, but like for medical stuff, but I use it as just like my everyday like chat that I have. Like let's say I drive from work, and I'll hop on like a chat GPT conversation, for example, and I'll just talk to the chatbot about anything in life. And I think it's helps a lot with self-care by just uh, by just like having a person to talk to. Fortunately, in my life, I have like people that I can go to, and I can is something that is happening, like something bad is happening to me, I can go and I can rely on. But and Umar is back. I think so. Hold on a second. Let me get him back.
Don't,
Yeah,
don't
Umar
worry.
is back. You're back. I'll just finish with my answer, and then you can dive
Oh,
back. So,
thank you for that.
uh,
Yeah.
as I was saying, like, but if you don't have somebody to go and talk to, and even I use it sometimes. I'll go and I'll just go and hop on this conversation with ChatGPT. I'll put my AirPod in and I'll just talk. And if there are some problems, always like obviously use it cautiously and like try to understand that uh, maybe it's not the best medical advice and you have to seek a better. And maybe there are people are developing it. Maybe like healthcare professionals, along with IT specialists, developing a new tool that can be a really beneficial, kind of like virtual assistant, a chat bot for people with chronic disease and, as you said, medication adherence. But it's yeah, but I think there. It's a great tool. Like people do, for me, people underestimate the kind of the comforting thing that anytime you have you have a problem, you can go talk to this. Maybe it's virtual, but it's still better than nothing. It's still better than just sitting alone with voices in your head in your room and not talking to anybody about your problem. And it's also really good if you're sometimes I'm kind of being like kind of open here, but sometimes I'm being shy about my problems. And like I'm afraid to go talk to like even my parents or my girlfriend or anybody, like my best friend. I will not be comfortable going there and talking to that to about my personal problems that I have in my life. And this is where this AI that I'm talking to comes into play. I can go and talk to AI and then even ask, should I bring it up to my parents? Should I bring it out to my best friend? And how should I do it? And I think there's a lot of development happening in that sense. On top of what Omar was saying about how we can combine all the devices you have. Obviously, if you have chronic disease, you probably have multiple like a glucometer and blood pressure device, and I don't know, I don't want to go into details a lot, like maybe a scale, something that goes like and analyzes and combines everything, and
Yeah,
AI will definitely help like give you a better solution to the problems you have in your life. Anything
yeah,
to add, Omar?
yeah. Again, yeah, I agree with you 100%. And so, again, at the end of the day, assistant can only work, or chatbot can only work as long as it is provided your details
Yep.
uh, from different sources, like you were talking about, and like a smartwatch, number of steps you've taken, or if you need to take more steps, so it's going to assist you that hey, your 10,000 steps goal count goal of the day is not yet achieved. So and it also helps in motivation as well. So
Yep.
yeah, this kind of stuff. It can be not your personal assistant, but maybe a coach or a mentor.
And one last thing that I'll add on this topic is that having like numbers put in front of your face helps you a lot. Like if somebody comes to me, my doctor comes to me and say, "Hey, you have to drink X amount of water today,"
Mhm.
and then I don't track it. Yeah, I do drink it. Yeah, I know I do drink it. And then when I go track it with my like I have this watch now, for example, I can
Mhm.
track like how much I walk a day and how much I drink a day, and I'll
Mhm.
put in my like details when I wake up in, and I can see that like how is it happening, was fluctuating, what happened yesterday, what did I drink enough water, and I can actually understand. Oh, hey, doctor was probably right. I was drinking like 3 out of 7 days in a week. I drank enough. 4 days I didn't drink enough. And this is
Mhm.
something like quantifiable that I can put like
Yeah.
number and you can actually see because it's not that people are trying to make themselves feel bad. Sometimes they don't even know they're making
Mhm.
themselves feel bad. Okay, enough with this topic. I don't want to keep people for too long, Omer and our viewers. I don't really like when the podcast or like some conversations happen for too long. So kind of let's dive into the last question and kind of
Mhm.
let's put a good final answer here. Get out of
Yeah.
Omer. So and I'm looking here because I have this question written down here. So the future of agentic AI, and again, as I said already, AI is so fast that you don't know what's going to happen tomorrow. But what would you predict? So with agentic AI in healthcare in next, I would even give 5 years, and I know that's even 5 years. That's too much with what
Yeah.
happens every day in the
Mhm.
AI industry. But what would you predict? What will be like? How will reshape? What will be maybe easier, maybe harder? I don't know. What will agentic AI do to healthcare?
Yeah. The way I see it, it'll evolve from an assistive tool to an integral part of the healthcare decision making, and helping streamlining operations. So what I see is it's going to be fully autonomous revenue cycle management. By fully autonomous, I'm saying, yeah, inverted commas, fully autonomous, right? And definitely, AI powered clinical decision support is going to be there. AI agents will be assisting doctors by providing real time evidence based recommendations during consultations. And then also, I see personalized AI driven preventive healthcare. Yeah, right
Mhm.
now we are more towards reactive healthcare, right?
Yeah,
uh, Reactive medicines, and so AI will be helping shift towards this proactive care and predicting
be more proactive. Yep.
disease risks. Yeah. So from the previous question, that AI coach or AI personal assistant is also be continuously going to be monitoring your, which is currently happening as well. It monitors your vitals, and based on your vitals, it can definitely uh, predict any risk of any severe heart attack or any such kind of thing. Yeah. And and furthermore, 5 to 10 years. I mean, not 10 years, but yeah, maximum 5 years. The way I see it, in hospital management, it's going to be autonomous system. That'll optimize everything from staff scheduling and or utilization and bed assignments or the supply chain management, or and making the hospitals run more efficiently, and then like enhanced healthcare and remote monitoring, remote patient monitoring. We have done one episode on that previously.
Yep.
So that is going to be more enhanced, and virtual health assistants will definitely become a commonplace, and monitoring patients in real time, and detecting potential health issues and alerting the caregivers before problems escalate. So that's where the agentic AI comes in. Alerting the patient, alerting the caregivers, making a call immediately, and doing all those kind of human things. This definitely can be handled by agentic AI, as long as it's all about. It's just a matter of adoption and building trust over it.
Yep. And then again, I'm not like a real good expert on AI, so that's why try to bring Umar to answer all the questions that we have. But again, I I think there's a lot of things changing, and even in my
Hmm.
my experience, not that long of experience, AI changed a lot of things already, and I see AI being implemented every day. And I know people are getting tired of hearing AI from every single corner, but in my opinion, even in my life, it's making my life a little bit easier. I'm not gonna lie, it's a little bit easier. I was able to manage to like eliminate some unnecessary tasks that I had during my day, like everyday life. So I think that having a lot of good good development is great. And then I think there's a lot of bright future for the AI in healthcare.
Mm.
With that, we're gonna wrap up. Omar, thank you very much. Everybody who's watching us on any platform, please leave us a comment, obviously, and we're gonna respond back to it as soon as we can. Leave us a like and subscribe to all of our channels. If you like what you're seeing, we're gonna bring more of AI, because AI is for us. For me, there's a lot of future happening with AI. Umar, thank you very much. We're gonna
Thank
wrap
you very
up
much.
here, and then we'll see you. We'll see you soon.
Sure. Thank you.
Okay.
Thank you. Bye
Bye bye,
bye.
everybody.